Hi, my name is Aiza Gayak, and this is our group mental health presentation.
Hello everyone, I'm Dolma Choezom. Today I'm going to present you about the postpartum depression in teen mom. I'm also going to discuss about the case scenario of teen mom with limited support showing signs of postpartum depression and issues related to the case study. Postpartum depression is a non-psychotic depression that women may experience shortly after childbirth. It usually starts within the first month after childbirth and can last weeks to months. In more serious cases, it can develop into chronic episode of depression. Pregnancy is stressful and challenging for every mother, and these issues are compounded for teen mothers who may not have the financial, emotional, or social support. Researchers have found that twice as many teen moms are at risk of developing postpartum depression as their older counterparts. According to a survey of 6,400 Canadian women published in the journal Pediatrics in May 2012, the highest incidence of postpartum depression occur among girls aged 15 to 19 at the rate twice as high as postpartum depression in moms older than 25. A study published in August 2014 issue of Maternal and Child Health Journal found a correlation in teen moms between increased stress from parenting and the risks of postpartum depression. Scenario: during the home visit, community health nurse met a client, Maria, 16 years old, who is living with her mother, Linda, in her apartment in Rexdale community. Linda was abused by her husband and separated since then and living in a subsidized apartment. Maria dropped out from high school after her pregnancy and her mother is the only support system. Maria looks tired and in unpleasant mood. While having conversation with her, she verbalized, "I'm tired of waking up in the night and not having good sleep after my baby was born. I do not feel like going out with my friend. Now I do not have good relationship with anyone and I do not think I have good bond with my baby. I think I'm not a good mother. I'm feeling hopeless." She also expressed about not interested in breastfeeding and observed her bottle feeding. Issues and health determinants related to scenario. Income and income distribution. Maria, being living in a subsidized housing with only support of her mother, could face financial difficulty which directly affect their health. Poor income leading to poor access to housing, living condition, buying nutritious and healthy foods, and poor health services affect the health status of individual and family. Poor support system. School dropout. Education plays an important role in determining the health status of an individual and also links with employment and income. Maria, being dropped out of school, could risk her and her baby health by not having proper health information and knowledge about taking care of her baby. unemployment and job security, leading to low income and poverty, which directly affect the health of the individual. Maria is dropout of school and not having a higher level of education could lead to unemployment and less job security. Social exclusion. Maria not having good relationship with her friend can make like a lack of access to emergency childcare and support which affect their health. The social inclusion processes that make up our life can have a huge impact on our health outcomes. Housing. Poor housing condition may affect health directly and indirectly. Signs and symptoms of postpartum depression and age. Being teen mom increase the risk from parenting.
Hello everyone, my name is Laguda. I will be presenting the assessment tool and available resources for a patient with postpartum depression. So let's talk about statistical tool used for patient with depression. EDPS, or the Edinburgh Depression Postnatal Scale. It is used for patients with high-risk depression or those who are already suffering from depression. So here is a sample of EDPS. It is a 10-item questions, basically asking the patient how she felt the past 7 days. As you can see, each answer on the questionnaire has its own rate, paying more attention to question number 10, where patient is being asked whether she has a thought of harming herself or anybody else. I have also attached the scoring guide to interpret the result. So if the result is less than 8, there is no likely depression. If score of 9 to 11, possible depression, and we need to rescreen the patient in 2 to 4 weeks and compare the result from the previous one. A score of 12 to 13 means fairly high possibility, and we need to continue monitoring the patient, give support, and offer education, or may refer to primary care provider. A score of 14 or higher means probable depression, and diagnostic assessment and treatment by the primary care provider or specialist is needed. Now let's take note that positive score 1, 2, or 3 on question number 10 means suicidal risk, and immediate discussion is required. So now let's proceed with the available resources for the patient with postpartum depression. There are lots of support groups in Toronto, but the one closest to our community is the William Osler Hospital, which is located in Etobicoke. Services offered is for women with postpartum depression, which can be seen in the outpatient mental health department. So who can make referral for the patient with postpartum depression? So here in William Osler Hospital, a physician or a psychiatrist can make the referral. So next is the Rexdale Community Health Center, who offers services, physician, nurse practitioner, dietitian, or mental health nurse. And who can make referral? So referral can be made by the primary care provider, the public health nurse, or even yourself.
Hi, I'm Evelyn Soriano, and I will discuss the plan of care, strategies to be used for client with postpartum depression, and how to build a trusting relationship. Nursing management. Nurses must be alert in sensing the current psychological state of the patient too. They must provide a precise data of the patient's well-being to give way to a more accurate care plan for a woman with postpartum depression. Nursing assessment. Assess the woman's psychological health even before the delivery. Assess her history of illnesses to determine if she needs any counseling prior to her delivery to avoid postpartum depression. Key signs and symptoms of PPD include sadness, excessive worry, feeling disconnected from the baby, forgetfulness, inability to focus or concentrate, anger, fear, guilt, grief, inability to fall asleep, waking during the night and having trouble falling back to sleep, exhaustion, and multiple physical complaints. Nursing diagnosis. Impaired parenting related to the inability to perform activities of daily living, secondary to postpartum depression. Nursing interventions. Assist the woman in planning for her daily activities, such as her nutrition program, exercise, and sleep. Recommend support groups to the woman so she can have a system where she can share her feelings. Advise the woman to have some time for herself every day so she can have a break from her regular baby care. Encourage the woman to keep in touch with her social circle, as they can also serve as her support system. Refer patient for psychological evaluation by primary care provider, psychologists, psychiatrists, psychiatric RN, counselor, or social worker, particularly one trained in special needs of women with PPD. Reassure patient she's not alone and that what she's feeling is real. Encourage patient to ask for help with baby, housework, and meals. Teach patient how to maximize sleep. As a public health nurse, assess the baby in home and provide follow-up care as appropriate. Evaluation. The patient engages more in social activities. The patient can express her feelings and insecurities. The patient can perform her activities of daily living. And the patient recognizes the importance of counseling and regularly attends one. Strategies to be used for client with postpartum depression. PPD screening. It's important to ask the right question and keep asking them to help patients with PPD get appropriate treatment. Even if you have time to ask just 2 questions, ask the 2 recommended by the U.S. Preventive Service Task Force for primary care settings. First question, over the past 2 weeks, have you felt down, depressed, or hopeless? Question number 2. Over the past 2 weeks, have you had little interest or pleasure in doing things? If the patient says yes, explore further by asking, have you felt this way for several days, more than half the days, or nearly every day? Another widely used screening tool is the Edinburgh Postnatal Depression Scale, a 10-question tool that has been well-tested, validated, and translated into many languages. It can be completed by the patient in about 5 minutes. Offering a referral. If you suspect PPD, offering the patient a referral is the first step. Urge her to contact her primary care provider or refer her to a local psychiatrist, psychologist, psychiatric nurse, family therapist, or licensed clinical social worker. Keep in mind that many women with PPD are too overwhelmed, exhausted, or scared to make the first phone call without help. So be prepared to help them make the call if necessary. Know too that PPD support groups and national hotlines exist. Managing PPD. Many treatments are available for PPD, and with appropriate intervention, most women make a full recovery. The sooner treatment starts, the sooner they'll begin to feel better. Treatment option depends partly on patient preference. They include traditional talk therapy, antidepressant drugs, hormone therapy, and alternative therapies. In many cases, a step or combined approach is used. Some women may refuse drug treatment due to concern about medications. So professional may offer talk therapy first. This may involve peer support, group, or individual counseling, cognitive behavior therapy, or interpersonal psychotherapy. Patients can participate in this process in person, over the telephone, or even online. Merely communicating with others who have been through PPD can be extremely helpful. How to build trusting relationship with the client with postpartum depression. Create a trusting environment. Trust is essential since many of these individuals have previously been disappointed in their interaction with healthcare and social systems. It is important to follow through and do what you say you are going to do. If you do not know what the answer to a question, the best reply is, I do not know, but I will try to find out. Show respect, compassion, and concern. Vulnerable persons have been defeated again and again by life circumstances. They may have reached a point where they question if they even deserve to get care. Listen carefully, since listening is a form of respect as well as a way to gather information to plan care.
Untreated postpartum depression can have adverse long-term effects. For the mother, the episode can be precursor of chronic recurrent depression. For her children, a mother's ongoing depression can contribute to emotional, behavioral, cognitive, and interpersonal problems in the later life. And that's the end of our group presentation. Thank you everyone for watching, and we hope you enjoyed it.